afternoon, ladies and gentlemen, attendants of today's symposium. Thank you for being very much on time. And we have many more people registering and who have registered for this symposium. And we believe they are going to join us in the course of time. So without taking much of your time for waiting, we would like to proceed, and I would like to introduce our today's speaker, who is Dr. Derrick Kasozi. Dr. Kasozi is a pharmacist with more than 10 years of experience in community pharmacy and the importation of pharmaceutical products. He is currently working with the Rocket Health, which is the leading telemedicine company in East Africa. And today we are lucky to have him again to present to us the talk on telemedicine and integrated last mile pharmacy and laboratory services, lessons from private digital health company in Uganda. So we are looking forward for a very nice presentation and a warm discussion at the end of this talk. So if you have any question or contribution, please prepare it and you will give it at the end of the presentation. With that, there are two ways to give your contribution or to ask a question. The first one, you can use our chat function on the chat box and write your question or contribution, and it will be read out for you. And if you would like to ask your question in person, please feel free to use a hand function. You can raise your hand on reactions, or you can just switch your mic and start speaking. So that will be good to follow so that we can have order at the end of the presentation. Also, it will be good before you ask your question or give your contribution, you give a brief introduction about yourself, who are you and where are you, so that we can have a better understanding of who is asking or contributing. So with that, I would like to hand over the talk to Dr. Kasozi. Dr. Kasozi, if you hear me, please continue.
Yes, good afternoon, everyone. I hope each one can hear me. Can you hear me? You can get me? Yes. So good afternoon. My name is Kasozi Derrick, and it is a pleasure to actually be here and talking to each one of you. And I hope we can have a fruitful discussion after this, after my presentation. And yeah, I'll start right away. So in my presentation, we are basically going to look at how we have integrated as Rocket Health telemedicine with last mile delivery for both pharmacy and laboratory services, and the lessons basically we have learned trying to integrate these two together. So I'm going to start with what we feel are the biggest problems, for example, in our Ugandan setting, affecting our healthcare. And we believe telemedicine with integration with pharmacy and laboratory services, we can be able to solve some of these problems. So when you look at my first slide, we are looking at the problem. So one of the challenges we experience in Uganda is the structure and individual barriers to what we call universal healthcare coverage. And these problems include a low health sector investment, lack of public health insurance scheme, and of course, there's a high cost of private healthcare. The other problem we also face with is 40% of the total healthcare expense is actually paid out of pocket. Of course, that makes the private sector be critical in the delivery of healthcare services, but 70% of our healthcare expenditure is actually formed out of the individual pockets of different people. Then we also, what we call the private health insurance coverage still remains very low. Of course, one of the reasons why it is low, it's actually very expensive. So quite a few people can actually afford it. So some of these few problems, we believe telemedicine or what Rocket Health is actually doing right now, is a solution. So we need to look at innovations that can actually address some of the above problems I've mentioned. And telemedicine combined with pharmacy and laboratory services can actually go ahead to solve some of these problems by increasing maybe coverage and also reducing the cost of delivering the healthcare services. So when you look at when we did a study, basically we did a case study of Rocket Health itself as a digital health and telemedicine company. And we set the objectives for this case study. And the first objective was actually to describe the medical services delivered by Rocket Health. The second objective was to look at the digital technologies Rocket Health deploys in delivering these medical services in Uganda. And also to share, the other objectives was to look at the different facilitators and barriers to the adaptation of these telemedicine services in private healthcare. So those were the objectives of our study, case study, and Rocket Health being the main area we are looking at here. So after introducing this, so we want to go ahead to the methodology we basically used. So we focused on a period of March to October 2020. We focused on a period of March to October 2020, and we also used focus discussions whereby we talked to one director, 2 health workers, and also a senior software engineer. Of course, we did do an open-ended questionnaire that covered details on the different technology platforms deployed and how they were administered. Also, we had information concerning the different demographic information of the end users that will include the age, the gender, all that information was collected from our different platforms. And also data from the different encounters as regards to diagnosis and encounter costs. We did analyze it using our Excel 2020. So basically, what I'm looking at here is, I want to show you how does Rocket Health, how do we use telemedicine, add it with laboratory services, pharmacy services to actually deliver healthcare to different individuals. And how is it being taken up? How are people responding to it? And is it a solution to our problems, as I highlighted earlier, of high costs, problems of structural barriers, coverage, and is it a solution to the low uptake of insurance, private insurance, the expensive private insurance? Is it a solution to that? So that is basically, so what this method, what this so what this methodology is basically looking at is how do we attempt to show you or to share this with each of you, how we're able to. So how does it work? Basically, in simple terms, when you look at this picture, we receive a call from a patient. We have a 24-hour call center. We receive a call from a patient. That's one of the channels we use. The other channel we can use is a WhatsApp, SMS. Of recent, we are using a USSD code, *280#. Of course, we have, with the assumption that not everyone can access internet, but at least with the USSD code, you can actually do *280# and actually access Rocket Health. So from the different platforms, that information is relayed to our call center. A doctor is either calls you, or a doctor either answers your WhatsApp request, or a doctor can also do what we call a callback through the USSD code. So after having a conversation with the doctor can ascertain whether you need more investigations. That means you can send a request to the lab through what we call a lab.
Easier to do
through the lab. I'm going to request, please, could you please mute your mics? So the doctor can send actually a request to the lab information system, a request for a lab test, specifying which lab test they would want, depending on how much the doctors analyzed the patient and what they think is important to do in this particular case. Or the other alternative would be, there may be no need for a lab. A request is still sent from the doctor to the pharmacy through what we call a pharmacy information system. And also something I forgot to mention is that when the doctor is actually talking to the patient, they do capture the patient's information or the different signs and symptoms what the patient is expected to do what we call EMR, which is electronic medical record. It's a system we use to actually capture this information. And from that system, this system is integrated with these two systems of the lab and the pharmacy. So an encounter can either end up from the doctor to the lab, then eventually the lab technician is dispatched to the field to go and pick up a lab sample. The sample is actually collected, brought to the main lab, analyzed, and results are shared through, it depends on the patient, what the patient is comfortable with. It can be through email, and the doctor goes ahead to explain these lab results to the patient and the findings. After explaining these lab results, the doctor can also go ahead, if there is need, an encounter can move from the lab then to pharmacy where there is need for medication, or if there is no need, the actual encounter can stop with the lab findings, with the lab findings. Or in the cases whereby the encounter can actually just move from the doctor into the pharmacy information system, and eventually the prescription is actually filled and the medicines delivered to the patient. So the key points to note here is, at every one point, the lab pickups, the patient doesn't have to move away from wherever they are. We actually locate the patient and actually pick the lab sample. The same thing with the medicine deliveries. These medicine deliveries are actually delivered to wherever the person is. So the person doesn't actually have to physically come into a facility to have these different services delivered to him. Alternatively, the doctor could feel that a physical examination is important. So in such cases, we have what we call an appointment-based clinic, whereby an appointment is made for the patient. The patient comes in at that particular time to basically see the doctor. And after seeing the doctor can say, but the idea is you do not have to actually, the idea is to provide convenience and at the same time, just remove the traditional long lines and be able to serve the patient within the shortest time possible and make the customer experience quite simpler and non-stressful. The other alternative, the other portion is what we call the e-shop. When you look at the e-shop, we can actually access all these services I've talked about. The consultation with the doctor, the lab services, the pharmacy services, and the clinic appointment can all be accessed through the e-shop. You just have to go onto rockethealth.shop. And select whatever services you would wish to have, either lab service, either pharmacy service, or either clinic appointment, or even you can select both, more than one. So it's at the same time we are providing convenience. You are literally changing the status quo, but at the same time being able to provide medical care to these patients. So the other thing I could have also forgotten is that an encounter can also stop with just consultation. That means you call in the doctor listens to your challenge, and there is no need to do a lab test, or there's no need to have medicine delivered to you, and you just have a conversation with the doctor. So that can also be an encounter. So those are the five different ways our service operates as Rocket Health. So when we look at the voice call, for example, how does it work? How does the voice call work? The person, as you can see in the figure 2 illustration, the patient is calling the doctor, and the doctor is having a call. At the second night, the doctor can also call the patient. So it is a two-way one. You call doctor, the patient can call the doctor, and the doctor can also call the patient. The call to the patient could be from the doctor, could be a follow-up, or could be a callback. Like as I mentioned earlier, that recently we introduced a *280# USSD. So when a patient uses dial *280#, there's an option for request for a doctor consultation, and that appears onto the system as a callback request. So in that case, the doctor can call the patient and ask the patient what is the problem. Then the patient can actually explain. Or the other case is we have toll-free lines that the patient can actually call the doctor and then explain to the doctor what exactly the challenge is. So from there, that's when the doctor will capture the different details of the patient. That means the age, the sex, what are the symptoms, how is the patient feeling. Then from there, there will be an analysis. Then eventually, the different avenues, either lab or pharmacy, or actually the consultation will mark how the journey of the encounter will proceed. So all the information for the different patient, all the records, whichever patient has actually called, are captured in what we call, we have a database whereby we capture all the different information our patients to get. It is confidential, of course. We ensure that the information is actually well protected. We also have a messaging platform as another way of communicating. And in this messaging platform, the patient is free to actually send a message to the doctor, and the doctor through what we call a back system we call Rapid Pro, and the doctor is also able to respond to this patient using Case Pro, another system, another interface. The doctor can respond to this patient and be able to avail as much needed help as possible. Or, for example, there are some projects we keep on running, maybe about sex health education, and all the patient needs is to have a certain key and send it to 80, and then different messages are forwarded to this patient in intervals, in different regulated intervals. So the patient, in other words, the flow, it can be from 1 then to 2. That is when you use a specific key to access specific information and through messaging. Or you can go through 1, 3, and 4, whereby you send a message to the doctor is able to read the message, then answer you through another system we call the Case Pro. So these are different. We try to provide as much option as possible to the patient to make it more convenient, more easy to use the service, and being able to capture as many people as possible, depending on the different methods they have or they can use, and be able to also provide the healthcare as much as possible. So in our findings, we realized that as I said, it was between March to October 2020. We looked at 3,432 users. Of those, 41% were males and 59% were females. And as you can see, the highest uptake when you look at the age bracket was between 18 to 34 with a 36%. And also the lowest was over 50 years with 7%. I think as we can see that between 18 to 30, of course, the highest, that's mostly people with smartphones, more easier to technology than people with 50 years and above. That's why I think the uptake was more or less in 50 years. And as you can also tell that it's much easier for a younger generation to pick up such new innovation than actually an older generation. So that's why we have a very low uptake with 50 years and above. And when you look at the different services that were requested for, as you can see, consultation, just calling the doctor and having a conversation takes 40% of all the different utilizers we actually, based on of the 3,432, 40%, 40.7% just stopped on consultation, which was actually followed by pharmacy and lab with a 16%. And of course, the least, sorry, it wasn't sorry, pharmacy and consultation taking 31.8%. And of course, the lowest being consultation and laboratory, taking the lowest. So in that graph, as you can see, the different services with their different percentages and how the different clients or patients actually utilize the different options we have. In the next slide, we are looking at as I said, somewhere I mentioned that we did analyze data basing on diagnosis. We looked at we looked at which diagnosis was the most common, and in this particular case, we are looking at urinary diseases as being the highest, and the least of 11% being the gastrointestinal infections. But as you can see, most of these infections, what is very common is that they are outpatient conditions that can actually easily be managed. So, and these are the highest number of complaints in a hospital. That's what brings the queues. So we are actually, when you look at this assessment and this range, you see that we are capturing quite a number of people, and we are solving quite a problem that could actually be overwhelming, or it's already overwhelming for some people to actually go with just a simple infection, a simple upper respiratory infection, which can be handled by just maybe an antibiotic and a painkiller, and but then the person has to line up for 3 hours. So this tells you where exactly the telemedicine is actually the area it's actually solving. And then when you look at on this other side, the table that has facilitators and barriers. So one of the things that can actually facilitate uptake of telemedicine is education, educating people about how it works, educating people about how easy it is, educating, giving them and sensitizing them about the information and how you can solve their problems. Of course, it is a new concept. We are used to just walking into the hospital. So definitely there has to be a lot of education and sensitization to be able to reach out to as many people as possible and change their mindsets. So the other thing that could facilitate is the easy use, as in most of the discussions we have had with the different focal groups is that you should be able to make it as easy as possible to use, not make it. That's why you see, apart from the internet option, we have an SMS option, we have a USSD option, such that we try to be as diverse as possible to create so many options, but also creating so many options that are very easy to use, or actually that have being used to for some time. For example, you have been, ever since the invasion, or ever since mobile phones have come into existence or are being used, we have been using the USSD code. So that is something, at least use it to check for your airtime, check for maybe your balance of mobile money. So it is a much more easier way of doing things. So if you ease the way, we can access telemedicine. It is another way of facilitating its use. User empowerment, basically user empowerment. One of the things that we do as Rocket Health is that we have a chronic management care program whereby we remind our chronic patients, for example, when they're having refills. Let me say 7 days to the end of your previous medicines, a call is given to you to check on you, a call is given to you to know your status, a follow-up, and then also a reminder is sent that within 7 days, maybe your medicines would actually be getting finished in such a way, in such an option, the client is always informed about what they need to be doing. So when you keep on giving such information to different clients, different patients, they are engaged, and they would feel more comfortable using your service because you are keeping track of their health, you're keeping track of their needs, and that can also go ahead in hand to facilitate the use of telemedicine. The other option is creating as many platforms as possible. I talked about the calls, I talked about SMS, I talked about core USSD. There's also using the eShop. As many options as possible, as many as platforms as possible, it really would help our different patients to be able to access. So creating as many options as possible helps, facilitates the use of it, or the use of telemedicine, instead of just having one option, which may actually be overwhelmed, and some people will miss out the opportunity of actually using these services. Of course, we are also different partnerships. Different partnerships also facilitates the use of telemedicine. For example, now one of the partnerships as Rocket Health we're actually having is Jumia. We also have now Global and also Safe Border. All these are to ease the final consumer, to ease the journey the final consumer has to take to actually access our service. The ability to make the customer journey very simple and very convenient is the key to actually one of the things that we are trying to focus here on. And it will also facilitate the uptake of telehealth use. Although some barriers, there are some barriers, of course, the high cost. The high cost we are looking at in terms of the operation costs of the company. Of course, the expenses of actually maintaining are high. It is quite expensive because now you have to create different ways of making sure that different people actually, now, for example, at Rocket Health, we cover a total of 50 kilometers from wherever we are. So you have to find ways of making sure that wherever within the 50-kilometer radius, you have to provide means of reaching to those individuals. So that may require you to actually make a high investment in transport means. So it's quite expensive to actually maintain. Of course, lack of connectivity. One of the challenges we have in Africa, of course, internet. Not every place has a very good internet. So we really face the challenge of connectivity. Not everywhere there's connectivity. So some of the platforms may be hard, but of course that part of the solutions we have resolved is the USC, but even sometimes network is not good in some areas. So it's still a challenge. Of course, the legacy senior management, that is what we are all used to. You fall sick, walk into a hospital, see a doctor, go maybe for lab tests, the normal way we have been doing things. So basically changing the mindset of people to move from that to something new whereby, I can sit in the comfort of my home, someone comes and picks up a lab sample, they go analyze it, they send me results, they talk to me, then they bring me my medicines, or they refill my medicines without me going to hospital to get refilled. That changing that mindset and someone believing that actually my needs can actually be met takes time, and it's of course a challenge, but it's a good challenge to have also, because at least according to the uptake we are looking at, people actually buying into the idea for quite a number of different reasons. So in conclusion, as you can see, my first point is that there has been early and fast adopters in people actually embracing the idea of Rocket Health telemedicine, the way Rocket Health does it. And when you look, that was to 2020, because this study was done in 2020, but of course the numbers are way higher than that, because right now what we did, what was from March to October, and we're looking at 3,000. Now we have such a number and more, above 3,000 within a month's time. We literally have double that number, and that is already good. Of course, now when you look at the costs, with the current analysis, when you're basing on insurance patients, we have between 30 to 40% cost cutting right now. So that is how much we're actually saving from the different individuals, especially the insurance clients, because that's the information we have right now. But it's between a 30 to 40% cost cutting. And then when you look at the different barriers, for example, chronic patients, people of disabilities who cannot easily access these medical services, still telemedicine integrated with pharmacy and lab services has been of help. These people we can reach out to them. You don't have to move to a hospital to actually have your healthcare with the challenges you may. We reach out to you, we deliver these services to you, and be able to provide the necessary or what you need at that particular point. So it has solved the issue of reaching out to different people in different locations with different challenges, with the inability not to be able to access these health services, but telemedicine with these laboratory and pharmacy services has shown that it can actually overcome this challenge of access to medical health. The other thing is it's about the different channels of access. So because we are providing different channels, both visible and maybe text, we can be able to support the different clients or different patients or different individuals using these different platforms. As I explained to you that we have quite a number. So in conclusion, people prefer having more than one platform, as I mentioned. If it's one platform, for example, I would say the traditional way of doing things is you have to walk into the hospital. But you imagine you can access the services through using the eShop. You can access the services through using SMS. You can access the services through using WhatsApp. You can access the services through using USSD code. All these are different options provided to different individuals. So that, of course, people prefer using that because it helps them access their needs within a very short period of time, or be able to access without having one, depending on their limitations. As long as that option is there, they can actually use it. So that's all for me. Thank you very much.
Okay, thank you very much, Dr. Kasozi. Were you still talking, please?
Sorry?
Do you still want to talk? I had I cut you off.
No, I was just saying if there are any questions,
okay.
I'll be more than willing to answer.
Thank you very much for this very nice and insightful presentation. I have learned a lot of things from this talk, and I believe other members of the platform too. And now is a time where you can ask your questions or you can give your contributions on this particular matter on the table. And to remind you, you can do that by asking your question in the chat box, or you can raise your hand or switch on your mic and start asking your question directly. So we already have one question on the chat box from Gilbert Mateshi, and he's saying, is the cost saving on the patient's insurance firms, is the cost saving on the patient's insurance firms, or both? How do insurance firms save costs using this platform? Maybe Derrick, you can continue to proceed to answer that.
Okay. It's for both. Ensuring how do they save? For example, as I explained to you that we have carried out a research. I may not be at liberty to actually share that information yet, but the recent research we carried it was based on insurance companies, basically. That means patients who are insured, and then we run our data that on average, depending on what a person who walks into a hospital and the person who uses our services. And it has been discovered that it's between 30 to 40%. The usage, basically the usage of that person reduces by either between 30 to 40. Of course, the insurance company is going to gain or is going to save because they will spend less by 30 or 40% of what they would normally spend when a person uses a hospital the normal way working on. So in that way, yeah, it's saving. They are saving because if you have most of your clients using Rocket Health or using telemedicine to actually get their treatment, and each of them is saving 40 or 30 to 40 to 30%, then at the end of the day, your books are going to show that saving. That's how best I can look at it.
Okay, thank you very much. And maybe I have a question too regarding the delivery of medicines.
Yes, please.
I assume like you have a broad coverage over the entire country. Is that correct?
Yes.
And how do you contact with the pharmacies? How do you qualify pharmacists you are working with? And the second question is, do you issue prescriptions for prescription-only medicine? And if so, how does the prescription reach both the patient and the pharmacy? Or how does it work on your side?
I'll start with the last one of the prescription medicines. Now, our first and foremost, we of course we are like the idea that we have over-the-counter drugs and they are handled differently from prescription-only medicines. Mm-hmm. Now, when we are dealing with prescription, that's why we always have quite a very technical team. At every shift of the day, we have 2 pharmacists doing the clinical work. So one of the roles the pharmacist is supposed to perform is to ensure that every order that comes in this case, if it's not from the doctors, of course, with the doctors, it will have the prescription. If it's mostly from our e-shop or from our e-shop, it's a prescription on it has to have a prescription. So the first line is the patient is requested to provide that prescription. And of course, we use our WhatsApp platform to provide that prescription. With the pharmacist verifies the prescription. If there is need for a further consultation, if something is not clear, the doctors are always available. A doctor can be called in to consult. Prescriptions always have numbers. We can always ascertain which doctor has actually signed because these doctors are actually registered. We go through the process. Guidelines are, of course, available to us by Ministry of Health of how we can actually verify a prescription. Remember, part of our delivery team, the delivery team, these are pharmacy technicians. They're actually qualified individuals who actually go ahead when they deliver medicine. They again prove that actually that's the prescription you shared before they actually hand over the medicine, and then they retrieve that prescription, of course, for record purposes. So there are 2 ways of controlling before the medicine is actually given to the field person who's a technical person, a pharmacy technician, to deliver these medicines. There is need to verify whatever prescription you have given us. When we have done that and we are satisfied that it meets the minimum standards, the pharmacy technician goes to the field and then also verifies again to see what you shared is the same and it actually meets the minimum standard. Then eventually the prescription is taken away from you. We don't dispense out medicines that require prescriptions until the necessary requirements are actually met. The other question you talked about is about our coverage. Now, as I said, we cover 50 kilometers from where we are, but each of these areas, as I said, we are pharmacy technicians for the pharmacy part of it, and even for the lab part of it, there are laboratory technologists that actually go pick up the sample or deliver the medicine, respectively. And for upcountry products, for example, right now, upcountry we are now more dealing with chronic patients because these ones already their medicines are predetermined. So to remove the idea of a prescription, because some areas are very far and you can't send someone to retrieve the prescription. So we limit it to a chronic patient. But of course, for over-the-counter medicines, things that don't need prescription, maybe cosmetics and all, those ones you can actually, we have a third party partner who actually delivers to the rest of Uganda. But for prescription only medicine, it's restricted to chronic patients because we know that these medicines are being prescribed and the person takes this much and the person is on these medicines. So that can also be justifiable. But for cases of upcountry where we cannot easily reach prescription medicines, we don't send them there. We actually stop within a 50-kilometer radius. Yeah.
Okay, thank you very much for that nice response. We have another question from Gilbert Mateshi in the chat box and saying, for home consultation, laboratory, and medicine delivery, is that cost covered by the insurance firms or patients? Please.
So, so our insurance, the understanding we have with the different insurance companies, that is almost every insurance company in Uganda, is that they do cover the transport costs. Yes, they actually do cover those costs to go and pick the sample or deliver the medicines. They are covered by the insurance plan, and as long as the patient is insured, the insurance company will cover the costs. But if it's any issue of a cash patient, then the patient has to use their own money too. So this applies to only insurance. Insurance will cover for the cost of transport, of picking the sample or delivering the message, the medicines. But for the cash patient, you actually have to pay.
Okay. Members of the forum, if you have questions, you can continue typing them on the chat box or ask them direct here by switching on your microphone. And maybe, Derrick, a follow-up question on insurance. Were there any difficulties or resistance on these insurance companies to accept the concept of telemedicine and start covering for their patients?
Yes, of course. As I said, that this is an innovation which it had never been heard of. It's very hard to convince someone who has been used to a certain way. They would think that you're actually very expensive. But I think the way insurance companies appreciated it most is when COVID hit and we had a lockdown and people could no longer go to the hospitals and they needed access to medical care. And we were there, of course, to reach out to everyone. So the resistance was there at first, but when the wave came in, this was their mindset. They saw the importance. They actually appreciated that it's actually cost effective, which they are scared from the beginning that it could actually turn out to be more expensive. And well, that's why most of them at first were resistant to enroll for the program. But then eventually when we went into a lockdown, our first lockdown, they appreciated that actually there was a need. We needed to adopt to a new normal, and the option for that new normal was actually the telemedicine and integrated with both pharmacy and laboratory services.
Okay, thank you very much for that. Maybe to connect with that, how about the regulatory issues with the Ministry of Health in Uganda and others? Because we are dealing now with the launching of your things stage, how did it go there? Because we know it's also a new thing in our region.
So, of course, like any other government or ministry or regulatory authority, they are more concerned with how can you maintain the quality of service? How can you make sure that quality medical care is given? How can you make sure that the challenges are we don't cause more harm? So of course it was a new concept, but the Ministry of Health has been quite supportive, especially when they saw its role it played in the COVID way, in the lockdown. So, and of course also knowing that we have a bulk of professionals at every one time makes things much more easier. They know that quality assurance is always maintained at that level. So that alone, and there's no really law in Uganda to regulate yet as of now, telemedicine, but right now we are working with the laws that generate every healthcare system or every healthcare facility. But it was much easier for ministry to appreciate it when you have a bulk of these professionals and they have taken them through the normal process. They are qualified. You describe the process. So for now, that of course has helped, but it wasn't something that ministry was easily to buy into. But as I said, when the wave happened, people needed medical care. Of course, ministry saw that this was an option. It was giving alternatives to the different people. And then, of course, the level of professionalism, the level of quality control, the level of ensuring that the final client gets the best quality healthcare that is there. I think that has enabled the ministry to actually appreciate and be able to accept telemedicine as an option of providing healthcare. Okay. Of course, more is being done in the coming year. More will be done, but as for now, I think the ministry has really appreciated the work being done by Rocket Health using telemedicine and laboratory services integrated together.
Okay, thank you very much. There is a compliment from Cleophas Elisha, and he's saying this is such an amazing invention on health. Well applicable, and however needs public awareness to improve the community understanding. So I believe can you respond to that?
Yes, of course. Of course, I think among the barriers I explained was the challenge of mindset. But of course, with more, we need to avail more information to the public. As I said, this is something new. It will take time, but I think we're already making different strides towards changing people's mindset and making them aware of this option. As I said, now in Uganda, we almost have all the insurance companies on board. So that is already a certain section of people aware of that. So definitely we are going to even do more in the coming months and years to keep people. We want to make it the option to healthcare. And of course, basically the option to healthcare, as you can see, the world is shifting. A few years ago, we didn't know about Zoom. We are now having this discussion on Zoom. We would actually have to travel somewhere and actually sit in a hall, but now we can have this on Zoom. So it has taken time, but people have actually embraced Zoom. So telemedicine can actually become the option of way of delivering of healthcare. So it will take time, but yeah, we're actually working on sensitizing and making people aware of this option of delivering healthcare.
Okay,
it's work in progress.
Okay, I see the hand of pharmacist Mujahid Hussein Valji, and welcome Mujahid to ask your question.
Thank you. Good afternoon. Excellent presentation by Dr. Derrick.
Yes.
Just a quick question. I think, as you have rightly so, one of the challenge or obstacle that comes along is the education, right?
Yeah.
So, in your experience, which is the best way, or what is the best method to convince or to educate people on? So you said you have I think one milestone that you have reached is you have got the insurance people on board. That's one of the obstacles. But the other is still people like in our setting, we feel people are still not convinced about being treated online. So how would you tackle that, and what are the major strategies that can be done to change the people's mindset on this?
Okay, right. Of course it cannot be one strategy. That's the truth. There are different sections of our community respond to different things. So it's a combination of strategies. Some would find it much easier, for example, using influencers on Twitter to actually talk about telemedicine. Others will find radio being an alternative. Others will find TV being an alternative. Others would find, for example, there are what we call camps, medical camps. We always organize out in the different communities. In other words, you go and reach out to these individuals and actually tell them about what telemedicine is about. So basically, it's not one way. I can't say that this is the way that works, but it is a combination of so many things like I've mentioned, starting with using social media, using medical camps, using conferences, radio, TV, and billboards, and even reaching out to different individuals personally to actually talk about it. So it's a combination of all sorts of things that we have at our disposal to reach out to different sections of the community. When you look at the research, you can see that even different age brackets have, some age brackets have a tendency to be more receptive to certain things than others. So you have to be creative and know what responds to what section of people respond to what method. So to answer your question in brief is that we are using different methods. It is not one. I've given a few of them. There are others, but I've given a few of them. And those are among the few things we are using to actually reach out and sensitize people. And the response is good. The response is good. So we just have to do it more and more often and for quite a longer period of time.
Okay. Thank you for that response. Cleophas Elisha would like to know if you have a center somewhere where people can also attend as a normal hospital visit.
Yeah, as I said, we have an appointment-based clinic. Basically, it's there for physical examination. It's not a hospital, it's a clinic. And we make an appointment. You just make an appointment. I'll come in at 10 and the doctor is available to you at that exact time that you would want. So yes, it is there. That center is there, but it's for appointment. It's not like your normal walk-in. Like there are some people who will walk in and ask for medical, we will provide, but we would always, we are looking at making life as easy and convenient for the patient. That's why we always prefer using the appointment based. You make your appointment, either you call in or you use our e-shop to make the appointment, and yeah, you get to see the doctor physically. That option is there. Of course, we know that some of our patients or some of our clients will still prefer the physical contact with the doctor. So yeah, we do also provide that option. As I said, we are looking at as many options as possible, but of course, trying to make the final client journey very easy and convenient and simple as much as possible.
Okay. Thank you. We have a next question from Nelson Boyer. I think you touched a bit on this on your presentation. Maybe he had not joined by that time, but you can help him to understand better. So he is asking, may I know the actual workflow for the medicine requisition as a patient, assuming I'm at home? Do you have an app? So maybe you can do a recap for him.
Okay, this. So when you look at when you look at this slide, first and foremost, let me talk about the app. The mobile app is still under development, but it should be launched very soon, but it's still under development. For example, I explained that there are different ways of reaching out to us. One of the ways is through SMS, through WhatsApp, through phone calls, or now the recent one is what we call the USSD, *280#. And all those options will direct you to the call center where the doctors sit. So you have you could have a consultation with the doctor if that's what you're interested in. And depending on the outcome of that consultation, it can either lead into a lab request or a pharmacy request. Lab request, they send a lab technician is dispatched and they will reach out wherever you are and pick a sample within a 50-kilometer radius, pick a sample from you, bring it back to the main lab. It is analyzed. Information is shared between you and the doctor through your email. The doctor will then give you a call to explain the results. Depending on what the outcome is of those results, it can either stop at the lab or it can then be sent to the pharmacy as a request for medicines, which are then delivered still in the comfort or at the comfort of your place. Or the counter can just move from the doctor straight to the pharmacy and the medicine still delivered to you wherever you are. So the other option of contacting us is through our e-shop. Maybe right now what you can use is our e-shop, rockethealth.shop, and then you can make a request of all these services, laboratory, pharmacy, or just a consultation with the doctor.
Okay, thank you. I see the hand of Mujahid again. Welcome, Mujahid, to ask your question. Mujahid, are you there?
Yeah. So I just had another question. Is this so this telemedicine, would it work for preventative health, or is it more of curative? So like routine checkup for this. So this telemedicine concept, does it work for preventative, so like routine checkups and such visits, or is it more for curative? And second one is, how do you manage the delivery of cold chain items?
Okay. Of course, one of the things I explained was that we do have routine checkups from the doctors. Like, for example, when we have treated a patient or a client, and after 2 days, the doctor will give you a call to check up on you, how you're doing, whether you're improving. Then from the feedback, a different decision could be taken. So yeah, it's also for routine checkup, definitely. We do make routine checkups. We do call our patients every after 2 to 3 days, depending on and for our chronic clients, we do routine lab checks within a prescribed period of time, and at the same time, of course, we do call them to check on them and see how they are doing. The other part is the cold chain. So far for cold chain, it is strictly insulin. We are limiting it to insulin, any type of insulin, and vaccines. Of course, we do have different packages we have designed for delivery, but again, the distance. Of course, the distance, certain distance. Now, when you look at upcountry, we do not send cold chain to upcountry. We find another, so we don't deliver it, but what we do within a 50-kilometer radius, definitely we do provide the necessary needed options to make sure that that medicine actually remains viable, because it's within that distance we can actually cover or maintain we can maintain the stability of the medicine. So we do, but it's limited, as I said, to vaccines and insulin.
Okay.
For now, of course, as time goes on, we are looking at other options of expanding that range to other products that need the same.
Okay.
For longer distances.
All right. Thank you. We have 2 other questions. One is from John Massey, and is asking, what happens if a patient needs investigation procedure? Can it be done from a distance, and how? And maybe you connect with the second one. Have you had COVID-19 cases with your clients? How did you handle those?
Okay. Like I said, for example, when you have a conversation with the doctor, and the doctor feels a consultation with the doctor, and doctor feels that there is need for maybe a physical examination, the clinic is the option they give you. Go to the clinic and the doctor physically, or if it's just routine lab, if it's just labs, they will send in a laboratory technician who will pick up that lab sample, and they say this is within a 50-kilometer radius. So that lab sample is picked, delivered to the main lab. The main lab runs it. The analysis is done. The results are shared with the doctor. then the doctor interprets them for the patient, and a treatment plan is actually drawn out if there is need for that treatment plan. For COVID-19 cases, there are guidelines according to the Ministry of Health how to do home care, and most of our COVID-19 cases were home care situation. Those are the ones we've actually managed. The ones that actually needed hospital, we are definitely referred to a hospital, but the ones that needed home care, there are guidelines of how to manage that, and that's what basically we incorporated into our management according to the Ministry of Health of Uganda. They give us different ways. Of course, they have changed over. There was a time whereby it was azithromycin, zinc, and vitamin C, but then it later was changed to vitamin, which was encouraged that we manage the symptoms, and vitamin C was in cases whereby a person can't really consume fruit. So they changed, but as I said, we have been guided by Ministry of Health, and we are able to assess that a situation needs a hospital. For example, one of the things we encourage our patients who we manage from home is to have what we call a pulse oximeter. And the pulse oximeter, the doctor is able to actually know your oxygen percentage, the concentration at every given moment. So in that way, the doctor can actually make a decision, say, I think where we have reached, you need now to go to the hospital. This is the situation. We can no longer manage from home. So all patients are required to actually have pulse oximeters, and we're able, on a daily basis, the doctors actually call these patients. They read out at different intervals. Of course, at different intervals, the doctor has told the client, the patient, that between this time and this time, you have to, within a period of 3 years, you have to tell me what you have to note down. So the doctor makes a decision based on the results you have measured. Of course, that's where we have these professionals that when these products or medicines are delivered to these clients, the professional takes the time to actually explain to the client how to use a pulse oximeter, how to record a pulse oximeter to the results. And that makes life very easy for the doctor to note and say, okay, according to that, you are either improving or now I think it's time to go to the next step, which is the hospital. So in brief, that is how we have managed such clients. Of course, the other option is we do have also other hospitals we do work with. We do have partnership with other hospitals. We have a partnership with Rubaga Hospital. When we feel the situation has gone beyond what we can handle, we definitely now call in Rubaga Hospital. They have ambulance services. They go pick up the patient, take them to hospital, and actually treat them. So it is a situation that we know where we know how our capacity stops and what we need, and we ask ourselves, what do we need to integrate into this system to make sure that we give you an all-round healthcare service. Yeah.
Okay, nice. So nice to know where you stop working and you refer the patient to the hospitals, and that's a very important highlight to know that at a particular point you refer your patient to the hospitals, and it's very nice to know. And we have 2 follow-up questions from Mujahid. You want to know if you provide oxygen, I believe, for those COVID-19 patients, if this is within your range of services, and if you also include end-of-life care in your packages.
We don't include end-of-life care. That is covered by the insurance companies. I think that is within insurance companies' capacity, but provision we don't provide. As I said, when the situation requires oxygen, we have third party. We have an arrangement with one of the hospitals in Uganda, one of prominent hospitals, Rubaga Hospital, and they're able to do that. They're able to come and get the patient and actually provide the oxygen. We do not provide the oxygen, but we do monitor the situation and make a decision when it is necessary to make that decision for the patient to go to hospital. Yeah.
Okay, thank you. Maybe I see no further questions in the chat box. I have 1 or 2 more, and maybe we wind up from there. And this is, how is the level of your optimism in terms of expanding to other countries in the East African community, for example? And if someone is sitting in this forum and they says, okay, I wish I could establish something like this in my country here in East Africa or wherever, what would be the estimated cost of at least starting these operations in USD or Ugandan shillings, so that someone can know how to place himself better? Welcome, Derrick.
Yeah, about expanding to other countries, there's a plan, there's a definite plan. I think at the right time, the company will come and elaborate more when the time is right. Apart about the money, how much you need, I can't estimate. That's the truth. But maybe if the person has interest, they could actually write to Rocket Health. Of course, when I'm sharing my presentation, I'll definitely leave in the contact. They write to Rocket Health, specifically the managing director. Then they could actually have the conversation of what it may take and how much it may take to start up such an establishment. So I am not, I can't give you the exact numbers, but I'm sure if you write to our director is called Davis, the managing director, I'm sure that is a conversation he can fully answer to its capacity. Yeah.
Okay, thank you very much. So members who are interested in such a venture, please take your time to write to the director, and you will have good response to help you in your planning. Maybe we take another question from John Sospita, and he's asking, what happens to patients who get prescribed with medicines which require administration of medicines at a particular intervals, like injections, let's say every 4 hours? What's the operation in this? Welcome, Derrick.
So, first and foremost, if it's, for example, 4 hours, of course, that may even require to be administration within the night. And that will definitely request that if you have a nearby clinic within your home state, they should actually be able to administer that medicine for you, because our clinic currently right now works from 8 to 6 p.m. We don't do the 24-hour services as of yet. But of course, that is an option that is going to be available very soon. But for now, we will recommend a nearby health facility to the client, and then the client will go there to have their medicines administered at the appropriate time. Yeah, that's what we do.
All right, thank you very much, Derrick. And I'm very happy that you came to this forum today and you presented this very nice talk. I believe, members, you have gained something new in your professional life, and it's going to help you starting your own ventures or even knowing that these services exist. And for those who are in positions of decision making, I'm sure you'll be more than supportive if these things start to come up in your countries or in your local locations. With that, I do not have any further comments or questions. And I return to you, Derrick, if you have any remarks to conclude, you're welcome.
Yeah, so I just have to thank the opportunity given to me to be able to share this wonderful innovation, and I believe telemedicine is the future. I believe as we go ahead to embrace technology, we should really endeavor to we are looking at a way of using technology to solve our day-to-day problems. That also should include healthcare. So to me, it's the future, and we should as much as possible embrace and try to solve the current challenges we have as a generation using technology to actually so that is all for me. Thank you.
Thank you very much once again, Derrick, for coming, taking your time to prepare this presentation and actually presenting it to us. And on behalf of the members, I would like to thank you very much and pass our regards to all other staff at Rocket Health. And we will be happy to have you or any other next time on the proceedings of your great invention there in Uganda. So I would like to thank also members for attending today's presentation. I would like to extend my thanks to the sponsors of this platform, the Action Medioa and the Christian Social Services Commission of Tanzania. And you can still see this presentation in our YouTube channel if you will have time later or in the following days. And I'm sure Derrick will send us this presentation and we will be more than happy to forward it to you. And with that, I wish you a nice day and all the best in your work. Thank you very much.